Welcome to my podcast. I'm going to talk today about another important topic that you could see in the clinical setting, or also one of the station for Lab 2. So the patient will come to you and say that they have issue with their breathing. They might indicate a certain situation which could predispose to this kind of thing. And you need to take a thorough history in order to understand the root cause of the issue. So, as we all know, here in the UK, you can get certain medication OTC, and one of them is those kind of, which is mostly for patients who have allergic rhinitis or issue with their breathing in order to get the instant relief. So I'm talking about rhinitis medicamentosa, which is basically imply excessive use of OTC decongestant, and this will lead to the habit of course, overuse and relying on those kind of medication, especially, and sometimes you will hear some people, they say, oh, I have a flu, I would like to cut the flu short, so I'm going to take those kind of things. And you find them also OTC, whereby you can get them without a prescription. So retinitis medicamentosa is a preventable non-allergic condition caused by prolonged use of topical nasal decongestant, which can, of course, lead to persistent nasal congestion and rebound symptom, which will exacerbate the condition. And most of the cases you need to advise against using them, and they shouldn't be used more than 10 days. That's the general known thing. And it involves also, after you stop using them, introduce corticosteroid nasal spray in order to tackle any inflammation. And of course, you need to explain to the patient, educate them, and stress about avoiding any irritant, use Sterimar, nasal spray, or irrigation, and also in some cases they said menthol inhaler is another thing. My condition, as I explained in some of my previous podcast, I don't have allergic rhinitis. I developed something called non-allergic rhinitis due to the assault I had a few years ago, which is 4 years ago now. And this caused me multiple problems, including my nose, because of the fracture of my nose, and I stayed for quite some time, of course, before they corrected. And this led to invertebrate hypertrophy, and the saga just continued non-stop, and now I'm having dysfunction in my nasal mucosa and the nerve which is supplying that area. It's basically, as we all know, it's about the autonomic nerve system and the balance between sympathetic and parasympathetic. And the sympathetic obviously is not working, and this is causing me all the time congestion, mucus, very thick, sticky, irritating mucus. It's very difficult even to expel, and my sleep is really disturbed. For instance, tonight I didn't sleep that well, and I'm breathing from one nostril, and it switched. I'm gonna write about it a paper, so it will be like a lived experience. Might help some people with my situation. However, I'm talking now about rhinitis medicamentosa, which has more or less some of this of the symptom and some similarity. And those kind of cases, if they are persistent and non-responding or refractory, they suggested that surgical intervention can be one of the things for the inferior turbinate reduction, which I had twice. and it says it's effective in persistent symptom. Well, we need to know from the patient themselves, actually, in order to understand, because in my situation, it was kind of different. So it's all about taking a proper history, listening to the patient, because the patient will tell the tale exactly, because they're the one who's living this bad experience or this condition. And whether you talk about it or not, you can just follow a textbook thing, because everyone differ. So, what's retinitis medicamentosa? As I say, it's similar to my condition in a different way. It's non-allergic rhinitis. It's chronic, basically, characterized by chronic nasal congestion, which I get, and I get dryness as well. And in the side of the fracture, I'm having crusts and stuff like that, which is really irritating, and I can't feel them once they get narrow. And I managed to take photo because I felt no one is validating what I'm saying. I recorded even myself how I breathe. I'm showing them, just in order to prove that's my condition, because I felt they're not understanding what I'm being true. So basically, always you have to have like proof and explain, and you need to keep explaining. Especially when I never had any issue with my nose before all my life. So, as I say, in this condition, it's basically because of the overuse of the topical nasal vasoconstricting. I'm just concerned why they sell them as OTC in the UK, because patients, they can misuse those kind of things. And I remember one of my acquaintances sent me a photo of this kind of thing and told me, oh, you need to use it, it's good for you, blah, blah, blah. They don't understand my situation anyway. However, at one stage, I bought them as well. I tried them only once, because I know they're a long-term implication. And the time I just sprayed, immediately I got a relief. I checked my nose from inside. I can see everything shrink down. The airways is wide. I was really feeling a relief at that moment of time, and then blah, blah, blah. It's back to stage one. And I told myself I'm not gonna let myself controlled by a nasal spray, so I stopped using it. And it's, it's expensive, of course, when you buy it. I think I buy it for £5 or something. And I bought also something I read in the articles about capsinol nasal spray, because it's not available in the UK, so it was only in Holland. So I bought it for, I remember, I think 25 or 26 pounds, which is very expensive. However, didn't help, didn't do anything, though I read only one review and I thought it might help. But anyway, back to the topic. So the condition is, as I say, it's called, the other term for it is called rebound rhinitis or chemical rhinitis. And it's just a condition that developed from using medication, overuse. And other medication can be implicated. It's like anti-hypertensive drug or contraceptive as well. Certain drugs for erectile dysfunction, as we know, some men they use those kind of medications, so they should be aware of their consequences. Also, some of antidepressant are implicated, and benzodiazepine and NSAID. So, in those kind of vasoconstrictor, the main, when you see or try to read the ingredient, it's basically mostly around oxymetazoline or exometazoline or navazoline. All of those are alpha adrenergic vasoconstrictor, which is provide a relief for short time. And the longer the use, the more the implication for the mucosal inflammation, damage, rebound, congestion, and dependency, obviously. And we don't want to reach to that stage, because once a human being become dependent on anything, you'll be like a slave for that kind of thing, and this will affect, of course, we know that the central nervous system will be, in a way, will have certain changes, which, of course, with time, it will be hard to set back things to normal. And in many states, it has been stated that this kind of condition is underdiagnosed because, I mean, the GP or whatever, he wouldn't, if he didn't assess the patient as a whole and taking a thorough history, he wouldn't know. From the horrible experience I've been through, for instance, the assault on the multiple journey of different department visits, I noticed that some they don't listen, and some they quote things wrongly. You said something, and you find them they wrote something else. And obviously, they are in a hurry because they want to finish you quick and have the other patient, blah, blah, blah. So that's another thing. And of course, the consequences is kind of significant for the patient, obviously. And you'll just leave as I have now, beside the pain that I have, of course, relentless congestion, disturbed sleep, diminished quality of life. Of course, you're gonna increase the cost for your healthcare and the cost for different visits. And of course, the self-medication when you are desperate and the long wait, which all cause this condition, which obviously some patients are not fully aware of the consequences, and they just want the immediate relief. So this takes us to the pathophysiology for this problem. As I said, it's multifactorial, as I mentioned about the medication, and it's not fully understood, like in my condition, it says it's not fully understood how it works, and it has been different theory being proposed that repeated application of the nasal decongestion cause, of course, downregulation in the central nervous system of the alpha adrenergic receptor in the nasal mucosa, which needs to reduce their responsiveness. And this is called tachyphylaxis. If you remember that back at the time when we were studying medicine and the physiology and the pathology, and this diminishes the effect prompt patient to increase dose of to increase the dose and the frequency in order to get a relief, and this of course will lead to vicious cycle and dependency. So, and this of course will lead to rebound vasodilatation, whereby you're gonna feel congested, stuffed, because basically the sympathetic nerve system tone is low, is not working, it's not functioning, and in that condition the parasympathetic taking over, and this will lead to the congestion and the vasodilatation and worsening of the symptom, because beta adrenergic receptor is exacerbated, which was implicated in the condition, and of course those vasoconstrictor, when you are using them for a long time, they will induce, of course, ischemia, as we know, and of course this will lead to repeated epithelial tissue injury, mucosal atrophy, and with long-term use, it will lead to damage and reduce mucosal responsiveness, and might go also to atrophic rhinitis, which is a problem in itself. And of course, we need to remember that there's certain preservative as well, and this will, of course, add to the mucosal damage and delaying the recovery. So the risk factor here, as I mentioned, is using those vasoconstrictor for more than 10 days. Of course, if the patient is a smoker, that will add more to the damage of the mucosa. Of course, once the congestion wears off, it will lead to rebound effect, and the patient will be in great anxiety and scared that the condition will come back or the symptom is just imminent, and he will use this nasal spray in order to stop the condition. So as you can see, it's very rebound and vicious. It's just one cycle leads to the other. So the patient will be persistently in nasal congestion, and the relief is just temporary, and it will recur, worse the condition. And in those patients, usually the nasal blockage without discharge. In my condition, I have discharge. It can be sometimes dribbling because of the sneezing and stuff like that. But mostly I'm having this thick mucus, which is really irritating and very sticky and hard to expel. So, and the patient might tell you that I can't live without this decongestion because I'm not able to breathe, I'm gasping for air, and I need to use them. They're like my lifesaver. And so it's just, as I mentioned, it's kind of exhausting for the patient, and you need to educate your patient. In terms of the examination, it says that the mucosa in that condition will be atrophied, it will be crusty, it might have squamous metaplasia from the prolonged trauma and the damage. And this is something, basically will be seen with the nasoendoscope or the anterior rhinoscopy. Well, I never examined my nose myself, but because of the long wait, and I felt something is not going right, and it took me time to realize what's this going inside my nose until I started to examine, and I can see the deflection, I can see the bulge of the inferior turbinate. It's a great agony living with that. Until now, they alternate and they enlarge. I can feel them, I can see them. So it's something I think anyone can do. You just examine your nose, just have your torch and a mirror, and just look inside your nostril, and you will see the thing. Before that, I never thought that I will examine my nose, ever. But here we go. When something happened, like what happened to me, you just started to think in a different way. So in terms of self-medication overuse pattern, as I say, patient may misuse using this intranasal decongestant from OTC shelves, which is present here in the UK in Superdrug, Boots, Home Bargain, you just name it, Tesco, also Asda, Sainsbury, Morrison, any shop. You just go in the sector of healthcare, you're gonna find them. You're gonna find loads of them. I remember I bought it like 4 or 5 times. It's menthol, nasal spray, but I had to read the ingredient that it doesn't have any vasoconstrictor because I don't want to go on the vicious cycle, and it was really expensive. It cost me £6.50, I thought that the smell of menthol will help clearing. Well, that's what it says in the leaflet, but it didn't help, to be honest. I was feeling like it's just like a distractor, and you just need to be. I find myself I need to go in the cold in the early morning in order to help my nose to breathe. And of course, if I sit in any place with heating on or a crowded place, oh, pardon me, I'm having the mucus now. So yeah, I'll get blocked immediately. 2-3 weeks ago, I had an appointment with my GP, and I was waiting for more than half an hour in the reception area where the heating was very, very extreme, and I can feel my nose is blocked. And there were a lady beside me. She was coughing, having flu, blah blah blah. So once my GP called me, I demonstrated for her that I'm having now block. I've shown her how I'm breathing, like the one I recorded. She didn't even document that, though this is very important. It should be documented. Anyhow, and of course, I got the flu from the patient who are sitting beside me. And at night, I started sore throat and coughing. And I was in too much agony because I'm already having issue with my nose, and if I get flu, I will be in a very terrible situation. So yeah, here we go. That's the life I'm having now, beside the pain in my neck, on my armpit, my shoulder. So what I'm trying to say here, once you see your patient, take a thorough history to understand the root cause of the problem, and try to enforce them, educate them, make them in charge of their life, and that they need certain habit to be changed in order to avoid the vicious cycle and the agony of living like that, because it's a kind of agony. It's a disability, I would say. It's a difficult situation. It's limitations, stuff like that. So you need to empower your patient. Try to explain to them that you need to discontinue the offending agent. If I was in charge, I will take those medication and throw them out of the shelves. But obviously, it's all for money. Companies making them to make money, like the slimming injection nowadays. Everyone is buying that, and everyone just not making any effort. Just want the easy solution. So you need to make them aware. This will take some time to notice difference, and warn them about abrupt cessation, because this will cause, of course, instant block and rebound. Prescribe for them intranasal corticosteroid, this one spray, to control if there is any lying inflammation, and of course gradual weaning. And if the patient says that I'm using this, for instance, 4 times a day, tell them to decrease it by 1 until it started to be 1, and then until you can do only in 1 nostril at a time, not both at one time, until you wean the medication or the offending spray at one time. And support them, offer a regular follow-up in a few weeks' time, and give them, of course, Tiramar, and being supportive for your patient in order to be willing to stop this. Because if you are acting in a way that, when I've been through some of the, colleague, which is, I felt they are not even, sadly to say, empathetic or sympathetic. They just like to rush things, and it felt very awful. And if a colleague is not understanding, then there is no point So sympathy is very important, and empathy, and you need to, of course, there's a difference between empathy and sympathy, but to try to understand your patient, and try to understand where this comes from, and avoid using the word I can feel for you or I totally understand, because you don't understand anything. You're not in their situation, and you can't. You could say, I can see what you are talking about. I can see where this comes from, but don't say I understand, because you'll never understand unless you are in the same situation. So this is another thing you need to do, and especially in PLAB 2, they don't like it, so they're going to fail you for that. So, as I say, being supportive, offer, of course, nasal saline, irrigation, ceramide, which assist in the mucociliary clearance, hydration, intranasal steroid like mometasone or flexnazone to reduce inflammation and support mucosal recovery. And of course, the one I just mentioned, Mentanol inhaler. It could help in a way with the eucalyptus, which is a menthol or tea tree. It's just temporary, as I say. I bought it like 4 or 5 times, and then I decided I'm not going to buy it again. It's not going to fix the issue. And of course, if all of that did not help, you will refer basically to the ENT, which is going to take a long time to be seen. And they will supposedly assess the situation and see if there is any abnormality, any mucosal lining, any underlying issue. And they're supposed to see if there is any mucosal changes, any congestion, any abnormality, any septal deviation, any terpenate hypertrophy. All of that they're supposed to see, comment on. And then they supposedly need to discuss with the patient what's the supposed or proposed things to do moving forward, according to their, of course, facility that they have. I remember I've told certain stuff they say that we don't have in this facility because I was reading certain articles. Well, basically, I was reading in different areas because, you see, this e-bike rider caused me multiple problems, fractured my left hand, little finger, and that took me a long time to understand because I don't know about interossei, and the fracture. I never had any fracture in my life like this, so, and the problem, they didn't correct it, so I'm having also a problem with my left hand anyway. And then the nose thing started to realize it lately as well, because I wasn't being equipped with the knowledge to understand what's going on. So I was searching in the internet all the time, why I'm having this, why I'm having that, and one leads to the other to understand the situation. Then I went to a walk-in nurse who told me you have a bulge inside your nostril. I could see it even without any torch or mirror. I just stood in front of the mirror as she told me, and I could see, and from that time I started to search what's that bulge, because no one of the ENT specialists explained this to me, and they just were contradicting each other. One doesn't agree with the other. And of course, you've been seen after like 8 months or 10 months wait. What a lovely journey anyway. So basically, as I say, they should give a leaflet to the patient, explain what they gonna do, proposing pros and cons, because you can't just tell the patient, oh, we're gonna fix you, without being understanding how they're gonna fix me. You can't just say, I'm gonna fix you. You need to explain what are you going to do, what's the pros and cons, and the patient can't decide if that's something they want to go for, because that fixed thing you think they're gonna offer might cause other harms. So, nothing will go back as it was before. Just, need to balance between the benefit and the risk, of course, as we all know in medicine. And to know if this will offer long-term efficiency, and if the surgical management should be devised or tailored to the condition, because everyone is different. And it's very crucial to understand everyone's situation, and you need to document as well any finding. You just need to document the right finding, because I noticed from certain of the comment, and they just was writing even stuff they didn't do. It's like copy paste. And of course, you need to explain to your patient, avoid using or sticking to certain or multiple products, and stick only to the thing being given, and offer a follow-up in order to see how the patient is doing, because heterogenic allergic rhinitis is frequently overlooked and in general practice, and of course it has significant implications for the quality of life. And GP, they are the first to be encountering such conditions, so they should identify, manage thoroughly, and prevent this condition by thorough history, education, and what's the evidence-based therapy in those kind of situations. And any refractory symptom that could be beneficial by or benefited by surgical intervention. In that condition, you will refer, and it just you need, because a lot of patients or a lot of people, they are misuse those OTC decongestant without a thorough knowledge to their implication on the long run. By this, I hope that I covered most of the points about this one, rhinitis medicamentosa. And if you encounter something similar, you could come back to me, comment, and I will get back to you in another podcast. Thank you.